This video vignette is about a goals of care conversation. In this vignette, Maria Smith is a 35-year-old female with cerebral palsy and stage 3 colon cancer. Maria's been under the care of the palliative care team for several years. Within the last few days, she's developed nausea and vomiting and abdominal pain. After discussions between the palliative care team and her mother, Beulah, Maria was sent into the clinic for evaluation and subsequently admitted. The palliative clinical nurse specialist, Patrick, is talking to Beulah about goals of care as it appears that Maria's cancer has advanced, and so there'll be decisions to be made about further treatment, as well as care under the COVID era.
Good afternoon, Miss Beulah Smith. How are you doing?
I'm doing okay, Patrick, but I'm just really worried about Maria. She's been feeling so horrible, and I didn't really want to send her to the hospital, so I'm really glad you could see her in clinic, but she's just been miserable.
Well, she clearly is miserable. We're working to treat her pain right now. She has a lot of pain from the swelling in her abdomen, the ascites, and she's also working pretty hard to breathe. And that's been an ongoing problem for years with her cerebral palsy. So we're working on two really big challenges right now to get her comfortable.
But you'll be able to make her feel better, right? I mean, you guys always come up with great ideas. I'm so grateful palliative care is involved.
Well, I think we're going to be able to get her to feel better, but I think we're going to be challenged by keeping her feeling better with what's going on. And I think it's time we started having some really conversations about where she is in this illness and where we're going.
Wow, that sounds like, really serious. Is there something you're really worried about or you're not telling me?
Well, you've always told me to be very transparent with you. So I think this is one of those moments that we need to have a serious discussion. And are you up for that right now?
Well, I mean, if we don't have it now, we kind of have to have it later, right?
It's coming. It's just a question of when you're ready for this. And you need someone there with you.
No, I mean, I think I need, you know me, I kind of want to know what our options are. So I guess you better start talking. I might not be able to make any decisions, but at least I can hear what you have to say.
Well, I think with Maria, her colon cancer has been progressing pretty regularly every time we check her, despite the treatments. And I think her coming in today is a pretty much demonstration that the treatments for the cancer are failing. And she was at risk all along with her ongoing problems with the cerebral palsy. And so I think it's really important for us to look forward into what we should be doing in terms of treatments for her. And if she could answer, we definitely would be bringing her in on this. But I feel as if we're doing a lot of interventions that potentially aren't offering really any benefits anymore, and they're probably causing more burdens to her and frankly you.
Well, I mean, it's really hard because I can't come in with her because of this COVID thing. And, I know that you guys are really careful. And I mean, I've been worried about the cancer. I mean, I just think though, if we get her cancer better, I mean, won't she be okay?
I don't think this cancer is going to get better. And I think her time is becoming limited. And I think this is an opportunity for us to figure out what would be the goals for her moving forward. And maybe it would be to be able to spend more time with you at home than dealing with the side effects of the therapies, the chemo that have been offered. And frankly, she's so frail right now, I'm not sure we could treat her.
But I'm hearing in the news, with all these people with COVID, you have all these machines. Couldn't you just, treat her with one of those?
This really isn't about the COVID. She's got two serious problems in a COVID era. So I think if COVID were here or not here in the hospital, we'd be having this discussion today. I think the challenge we have with COVID is you're not here next door right now. And that's why we're having this conversation now. But this COVID isn't impacting any of the decisions that we're looking at right now. It's not changing my impression of the treatment plan. It's just knowing that she does better when she's with you, and she's not with you right now. And I suspect if we continue down this road of this aggressive treatment for a disease we're not really going to handle, and she's going to spend less time with you. And that's not really in her goals, I suspect, and I know they're not in yours, because you do better as a team.
Wow. So like how long do when do I have to make this decision by?
My role in this entire thing is to give you the information so you can make the best decision for you as a team that the two of you are. But I think the sooner you make the decision, the better it is for her. So I think if you want to take this afternoon and tonight and talk to other family members, if it will do you some good to come in and see her, I may be able to make an exception rule as we talk about goals, but it's going to be an exception rule. It won't be an ongoing rule. But I think it's really important to take this time for you to think it through. I've already had the nurses setting up FaceTime for you two whenever you want to see each other. I know right now she's not able to really make decisions or frankly talk. She's working too hard to breathe, but a familiar face may do her some good.
Wow. Okay. She must be really scared.
Well, it's a scary time to be in a hospital, and I think you know that too, why you've been trying to keep her out of here, out of the clinic and all. And, I don't want to put her through procedures if they don't offer benefit. And I don't want her to suffer. So I think those are the things we should be talking about, is things we should be doing to her and things we should never do to her based on her serious illnesses.
All right. Well, I feel like I need to talk to a couple of family members and stuff. Are you going to be around tomorrow that I can talk to you?
Absolutely. And if you want to talk to, our chaplains and social workers for other support, or your family does, I will make them available to you. You just let us know.
Right. Wow. Not the call I expected, but I think it's important, and I appreciate your honesty. I always appreciate your directness.
Well, our energy tonight will be to get her comfortable. Should her status change and she gets weaker, we'll be on the phone with you, because I don't think there's a imminent decision to be made. If things change, I'll be talking to you about that as well.
Okay. I guess I'll keep my phone close to myself all day and tonight as well, and I'll try to talk to some families.
Yeah, that sounds fair, and you know how to reach me.
All right. Thank you.
Thank you, and I'll be thinking about you. I wish things were different.